my name is Dr. Robin Abramczyk, and I'm a holistic and biological dentist in Heath, Texas. The name of my practice is Smile Ranch Dentistry, and I am here with Dr. Jenna.
Hi.
She is a chiropractor in the Rockwall area, and Dr. Jenna actually sees a lot of my babies that come here for frenectomies. She oftentimes will work with them before the procedure and most definitely after the procedure. And I would like for her to share with you a little bit about what techniques that she does for those babies.
Great. So everything I do as a chiropractor, especially with our pediatric pediatric and pregnancy patients, is all very gentle. We use techniques that are designed to allow the body to heal themselves.
That's wonderful.
Yes.
Okay, so whenever I send my sweet little babies to you, can you tell me a little bit of what do you do? Do you pop and crack? Or are you gentle? How does it work?
So it's all very gentle. There is no popping or cracking when we're adjusting our little itty bitty babies. So what we do is we find out where things are moving and where they're not moving. So for example, sometimes the cranial bones might be misaligned, or there might be a vertebra out of alignment in the neck. And all we do is very, very gentle, sustained contact on the places that are misaligned, and it lets everything just kind of fall into place just beautifully, and then the body starts to work the way that it was designed and processed to work.
Okay, wonderful. Well, on our frenectomy patients, we know that a tongue and or lip tie is a midline defect.
Right.
And quite often I'll notice that the tongue or the genioglossus muscle is very tight in the hyoid area, in this area that's below the chin, and sometimes they'll have a recessed chin. It's very tight and difficult quite often sometimes to get inside the mouth to do an exam or to do a release. So how do you work with a baby in that regard?
Right, and Dr. Robin, what I usually find with babies that have a tight tongue is the muscles aren't discriminating just on the tongue. They're usually rigid throughout their whole body.
Absolutely.
And so as we do our work with the spine and the nervous system to restore their body to function better, we watch them just kind of get loose and limber just after one adjustment, and then it's the repetitive adjustments that just reshape and remodel and allow the body to start being the way that it's designed and programmed to be. It's quite amazing.
That's wonderful. So do you see babies that have a tethered tongue or inner lip that have torticollis? And what do you do for them?
It's oftentimes connected. So what we do is just continue to work on the spine and the muscles. So oftentimes what's called a subluxation is when one of those bones in the spine is out of alignment. We work on allowing those to go back into the right place. It's all very gentle. And sometimes those subluxations were caused either from in utero constraint or the very difficult birth process. And so sometimes they go right back into alignment and they're fine. Oftentimes, because it's especially if it's the baby's 2 months old or 4 months old, the subluxations have been there quite some time. It takes a little bit of time also to correct those and make sure that they stay in the right alignment. So that's what we do.
Wonderful. And one last question for you. A lot of my mothers are interested in knowing, well, how many times do I need to go see the body worker?
It just depends. Just like if you want to go to the gym and lose weight, how many times should you go to the gym? It just really depends on the severity of the case. Usually we go visit by visit. I'll sometimes have an idea of how long it will take or how many visits, sometimes once a week, sometimes twice a week. In severe cases, it's probably a good idea for even 3 times a week right away, where we can really start to undo some of those problems, correct it, but it's all worth it. I'll post a testimony on your website about someone who came in and she's just doing amazing. She's sleeping throughout the night now, latching on perfectly, and you know, had she not been under that, the parents would still be struggling, and it's just, it's so worth it.
And thank you so much for taking care of my patients.
Yes.
I do notice that once they see you, and when they see you before coming to me, I'm always able to get into their oral cavity and do a better job. So thank you.
Great, my pleasure.
We have a very sweet one here with us today. This is Alistair, and he had a frenectomy a week ago.
He's doing wonderful.
And Dr. Jenna is going to show us how she does her adjustments.
Caitlin, do you want to say anything about after he had his first adjustment?
Well, he did latch on right after
For
his
the
first.
First time, and you told me he had struggled many hours.
He's been struggling with latch, so
That's really cool.
yes.
So
Definitely good.
typically I would analyze and clear the whole spine first for any subluxations. Those are the misalignments. But today I'm just going to focus on his neck. My hands are so cold. I'm just going to find out if one of the vertebrae in his neck is misaligned. Again, it's very gentle pressure. Sometimes the babies even sleep right through it. Good. So the very top vertebra is called the atlas, and instead it's what holds the skull. And so it should be aligned like this. It's actually slid over to the side, so it's not going to let his head rotate as well as it should. So I'm just going to hold sustained pressure there until it corrects. It's not even going to faze him. I think if anything bothers him, it might be my cold hands. Good. See how he's already becoming calm and relaxed? He likes his adjustments. Beautiful. And then I'm just going to very gently take my hands up and work on his cranial bones and make sure those are all moving properly. And all I do is hold sustained contact. He's even smiling. He likes that. Oh, how cute. Alistair, you're going to be a celebrity. I don't know, buddy. My hands are cold. And this is the most important cranial bone. It's called the sphenoid. What it is it makes the palate, the bottom of it makes the palate, and it goes all the way across, and all the other cranial bones attach to it. So it's very important that that one is moving right, so that the cerebral spinal fluid gets rotated and pumped through without interference. And that will help with the latching. He likes his adjustments. And then what I would do is some work inside of his mouth, checking his palate if one side's dropped or not. Do you want me to keep going and do that?
Sure.
Okay. So just going to come in here, see if he wants to cooperate. He's being stubborn. There we go. So the left side has dropped. I'm just going to hold and sustain contact and just very gently push up that palate where it's dropped on that side. And we see a sucking reflex. His tongue is in the way. Hey, buddy. And we can work on the jaw. And last time we did this, he latched beautifully.
Okay, wonderful. Thank you so much. So if someone were interested in getting a hold of you, how would they reach you?
The best way is to call our office. Our phone number is 972-463-9100, and our website to learn more is ibcwc.com. That stands for Ideal Balance Chiropractic Wellness Center.
Okay, wonderful. Thank you for sharing.
Thank you for having me.
And thank you, Alistair.
He was great.
And thank you for joining us today.